All right, today we're opening up the medicine cabinet to talk about one of the most common pills on the entire planet, ibuprofen. I mean, you've probably taken it a dozen times, but do you really know the full story of what it's doing inside your body?
Think about it. You swallow that little pill for a headache or a sore muscle and poof, you feel better. But what's really going on in there? You're actually kicking off this fascinating biological chain reaction, and today we're going to follow that journey step by step.
So first things first, ibuprofen isn't just a simple painkiller. It's part of a really powerful class of drugs you've probably heard of, NSAIDs. And its main missions are to fight three specific things: pain, fever, and inflammation. It's a triple threat.
Now, to really understand how it pulls this off, we need to shrink down, like way down, to the molecular level. You can kind of think of it as this tiny, targeted special ops mission happening right inside your body's cells. The main character in this whole drama is a chemical messenger called a prostaglandin. And honestly, the best way to think about these guys is as your body's alarm bells. When something's wrong, like you twist your ankle, they're the ones that start ringing like crazy, causing all the pain and swelling and fever you feel. So, how do those alarms get switched on? Well, it's a pretty simple three-step process. First, an injury happens. Second, special enzymes called COX enzymes, think of them like tiny factories, start churning out those prostaglandin alarm bells. And third, the alarms go off and you feel all the effects. Now remember those COX enzyme factories? They are the key. And this right here brings us to ibuprofen's one single brilliant job. It marches in and just shuts down those COX factories. It's that simple. No factories, no alarm bells. And no alarm bells means no pain, no fever, no inflammation. Sounds perfect, right? But, well, there's a little bit of a twist. You see, the thing about ibuprofen is that it's non-selective. And that's just a fancy way of saying it doesn't really care which factory it's shutting down. And this little detail is the key to understanding both its amazing benefits and its potential risks. It turns out your body has two very different types of these COX factories. You've got COX-2, the instigator. This is the one that shows up at an injury site to start ringing those alarm bells. It's the bad guy we want to stop. But then there's COX-1, the protector. This is the good guy enzyme. It's always working in the background doing important housekeeping stuff, and one of its most critical jobs is maintaining the protective lining of your stomach. So here's that double-edged sword in action. When ibuprofen blocks the bad guy, COX-2, you get all the benefits. Your headache fades, the swelling shrinks. But because it's non-selective, it also blocks the good guy, COX-1. And when that happens, your stomach's natural defense shield gets weaker, which is the direct cause of most of the common side effects. Okay, so with that whole mechanism in mind, let's look at what this powerful little tool is actually used for. What are its primary missions in the real world? Well, it has that three-pronged attack we mentioned. As an analgesic, it's great for all sorts of pain, from headaches to menstrual cramps. As an anti-inflammatory, it's a go-to for things like arthritis or sports injuries, like tendinitis. And as an antipyretic, it's fantastic at bringing down fevers when you're sick with a cold or the flu. Okay, now for the really important part. Because we know it blocks that protector enzyme, we absolutely have to talk about safety. Honestly, understanding the risks is every bit as important as enjoying the relief. The most common side effects are, you guessed it, directly related to that weakened stomach lining. We're talking about things like nausea, indigestion, or heartburn. For most people, these are pretty mild, but it's basically your body sending you a little signal that the protective COX-1 is being blocked. But there are also more serious, though thankfully less common, risks. That stomach irritation, if it goes on too long or with high doses, can lead to ulcers and bleeding. There's also a known increased risk of cardiovascular events, like a heart attack. And it can even mess with your kidneys, because it turns out those good prostaglandins are also vital for blood flow there. This is precisely why some people have to be so much more careful. If you've got a history of ulcers, heart problems, kidney disease, or you're allergic to aspirin, you really need to talk to your doctor first. It's just not worth the risk. And it's also so important to know what you shouldn't mix it with. Taking it with other NSAIDs or with corticosteroids, that just dramatically cranks up the risk of stomach bleeding. And combining it with blood thinners, well, that's just a recipe for a potentially serious bleeding event. It can even make some blood pressure meds less effective. So, after all that, what's the single most important thing to remember? How do we use this super effective medicine safely and responsibly? It all comes down to this one golden rule, and this comes directly from medical guidance. The goal is always, always to use the smallest dose that works, and only for as long as you absolutely need it. This simple principle is the best way to minimize the risks, because you're limiting how long those good guy COX-1 enzymes are being blocked. And here is a hard number to keep in your head. For over-the-counter use, the maximum recommended dose for an adult in a single 24-hour period is 1,200 milligrams. That's usually 6 of the standard 200 milligram pills. Do not go over that without talking to a doctor. And that's the full story of ibuprofen, a simple pill with a really complex and, honestly, a pretty fascinating job. From shutting down molecular factories to its double-edged nature, it's an amazing tool when you use it correctly. So, what common thing in your life are you curious about? Let us know. Thanks for tuning in.